Hello, I'm Dr. Pierre Samaan. I'm Director of New Horizons Institute of Counseling. I'm a clinical pastoral counselor, and I'm here to talk about depression today. We spoke about it the other day, and we're going to talk about it today and tomorrow as well. I hope this is something that will bring you a little more understanding for depression, but also a little more understanding in helping those you love, you care about, or those you even know who may be suffering from issues of sadness and blues, and sometimes fairly, if not completely helpless in the situation that it brings them. Depression is kind of a multifaceted issue. I used to work in a psychiatric unit when I first started in ministry and counseling ministry, and I think some of the worst patients were those who suffered from severe depression and psychosis and some other issues attached to it. And yet everyone got better by the end of their stay. And everyone did well for a while, and a few who had a more severe case of depression where it recycles, they would come back in maybe after a few years where their medications were becoming more tolerable to them. It wasn't quite as effective, and they would come back in for changes in their medications. But what brought me into the psychiatric unit was a hospital accreditation task force that determined that the particular hospital that hired me prior to their hiring me didn't deal with the spiritual in helping patients. And that was one of the requirements that they had before they would have another assessment. And knowing that I was at the time a member of the clergy and working on my first master's degree, they took a chance and said, okay, we're going to hire someone who's going to be able to talk to our patients spiritually. And it was a great experience working with those patients, great experience working with the staff, and a great experience for me because I learned so much about all the psychiatric problems as I worked with the psychiatrists in dealing with these various issues, depression being a very important one. There are different types of depressions, and that's what we're going to talk about today. We'll get a kind of an understanding of some of the foundational things. We spoke about it last time. We're going to talk about the types today. And then next time we're going to talk about discouragement. How can we overcome despair and discouragement? So looking at types, well, the obvious type, major depression, that's the big one. That's the one that can be so harmful and emotionally painful. And not only emotionally, but for those suffering with major depression, there's a physical pain that can come out of it, different for different folks, but it generates within that emotional pain that transmits to the body, sending a signal, causing physical pain of some sort, and it hurts. So major depression can be mild, moderate, severe, and can be to a point where there's psychosis involved. So another type of major depression is with psychosis. Most of you know what psychosis is. It's getting out of touch of reality. It's living in the fantasy bubble rather than in the reality that's in front of you. And in that fantasy bubble, there's delusions, there's difficulties in understanding what others are saying, understanding what you're thinking, and you go into a realm that's all your own. You don't see that a lot. But every once in a while, when depression gets out of control, it's at its worst, you tend to see that. And with the modern medications and other tools that help, generally they get over that fairly quickly. Persistent depressive disorder is another type of depression. Now, in the, I almost said in the old days, in the past, that used to be called dysthymic disorder. Dysthymia is a low-grade depression. So the new term persistent depressive disorder is that low-grade depression that tends to be there more often than not, if not all the time. It's normal is here. Persistent depressive disorder is just below normal in that realm where a person feels rather worthless and valueless, and they just have trouble being happy, have trouble putting a smile on their face. But one thing about that is when sadness deepens, there's a little dip. That little dip tends to go a little deeper, and because it's already down there below normal, that little deeper takes them into a major depression fairly quickly. And many times, they'll come out of it fairly quickly as well. But if they stay too long in that, it takes longer. So that persistent depressive disorder that I have to keep looking at the name because I'm used to dysthymic disorder, it's kind of irritating to have. And yet it doesn't have to stay down there. There are ways of handling it, and we'll be talking about that at another time. Perinatal depression is another type of depression, and basically it's when someone is pregnant. Some people get into depressions. Hormones change during pregnancy, especially if there's a history of depression. There can be perinatal depression or depression during pregnancy. Again, ways of handling that. It's not the end of the world. There's no reason to fear being pregnant if there's some history of depression, but addressing it as soon as possible helps to get you through it in a more normal fashion. And certainly having a baby is something to really look forward to. And the excitement oftentimes is stimulating enough to get through those little dips in our moods. Seasonal affective disorder, SAD in the initials, so they're SAD. Seasonal affective disorder basically starts coming around in the fall. The weather changes, the sun's not shining as much, and the moods just kind of get down there. The trees are changing, and there's this burst of color in the trees, which looks wonderful and all that, but then the leaves start dropping and it kind of gets dreary. Well, those people that are affected by seasons, that's the time it starts to dip. And perhaps they've had that low-grade depression, or not, but if they've had that low-grade depression, then it dips quickly. And then it starts picking back up in the spring where they start feeling better. The leaves start coming back, the weather, the sun, and all that. So certainly up north, you're going to see more seasonal affective disorder than you will down south. And I'm from Florida. I don't think we ever saw that in Florida, especially when I worked in the psychiatric unit. Hey, we had the sun all the time, and when it rained, it was sunny. So seasonal affective disorder is mostly up north. You're going to see it especially in places like Alaska, Canada, Antarctica, but in the northern areas of the United States as well. Disruptive mood dysregulation disorder. Dysregulation disorder is generally diagnosed in children and teens. It's more of a child and adolescent depression, dysregulation. You know, they don't like identifying children with a particular diagnosis. And the reason for that is they change. They change so quickly. Their hormones are changing. They could be one way one day, another way another day. But especially through those formidable years of adolescence, there's such major swings that can go on for many, not all, but for many. And those swings can change someone from being really good to really bad, from being really bad to really good, and then leveling out in their late teens and early 20s. So they don't like to identify a particular diagnosis, but sometimes they have to put a diagnosis down for insurance purposes or for treatment purposes. And so this dysregulation disorder is just kind of what it sounds like. Not regulated. Let's not call this person, this child or this youth depressed. Well, let's call it dysregulation. They're having trouble regulating their mood. And those hormones are just something. And those of you who have experienced those wide swings of hormones when you were teens know what I'm talking about. And then there's premenstrual dysphoric disorder. And wow, you know, we hear about that a lot, PMS. I deal with that often with clients. And even gynecologists, you know, they'll prescribe the antidepressants and so on, but sometimes the antidepressants just don't help with PMS. And so you have to look at various things, various treatments. But you know, sometimes the simplest are the best. Go to the health food store, talk with the counselor at the health food nutritionist at the health food store, see what they know works, what their clients tell them that work. And sometimes it's a combination of things. But premenstrual dysphoric disorder can be very discomforting, very difficult, not only for the woman, but for the husband or the children, the family. And so I've seen some just tremendous swings that can occur, Dr. Jekyll, Mr. Hyde type swings. And it doesn't have to stay that way. But it's hit and miss, finding those tools that will help. And then teaching the family, teaching the husband, teaching the children if they're old enough, how to handle that themselves, how not to be angry by the way mom is acting or the wife is acting, how to give encouragement, support, how to help them with just some of the simple tasks that are so difficult during premenstrual dysphoric disorder. That helps a lot. And it helps reduce that anger and that agitation that can come about there. But very often, you can be perfect in helping your wife or your mom as she's dealing with that on a monthly basis, and it's not good enough. But then when you know what it is and you understand it, it helps you to let it roll off your back, or go in one ear and out the other. And that's what you want to do when you're suffering with that. Don't suffer alone. Go see your counselor or your doctor and take your husband with you. Take your children if they're old enough with you. Teach them, help explain those things to them. And when you're dealing with other issues, like let's say anxiety, panic attacks, or depression, or some other problem that may come about, it can make that worse. It can make the symptoms worse of it. And understanding those other things helps the family to be able to understand what's going on. Now, a lot of people ask me, what is it any different for men or women when there's depression? Is it any different for senior citizens? Is it any different for children or teens? Is it any different for someone with a different type of handicap or someone who's dealing with more stress and so on? Do we eliminate all the stress, and how do we handle it? Is it different? And yeah, it's different for different folks. There's that basic symptom that occurs, those symptoms that we talked about before. But then on top of that, there's a few other things. So for women that have depression, it tends to be, according to the studies, more women have depression than men. At least more women talk about it, more women go see the doctor about it than men. But when they take that into account statistically, it still seems to be more women than men suffer from depression. Biological life cycle could have something to do with it. Hormonal factors can have something to do with it. Those are some things that are unique in women and can be linked to that higher depression rate. Women with depression typically are going to have those typical symptoms of sadness and worthlessness, guilt, and other typical symptoms that come with depression. On the other hand, men are a little different. And keep in mind, we spoke in an earlier video that our brains are different. Men and women's brains are different. In that 16th, 18th week of fetal growth, the mother secretes a hormone that bathes the fetus. And it has no effect on a female fetus if it's to be female. But if that fetus is to become male, that hormone is what triggers the male gene. And unfortunately for us men, it damages the left hemisphere of the brain of that growing fetus. And in damaging the left hemisphere, it actually will shrink that left hemisphere a little bit. Speech is damaged, the speech center in the brain where we communicate verbally. 9 out of 10 children in elementary school that have to go through speech therapy are boys because of that damage. Girls excel academically over boys in elementary school because we had that damage. And one client said, that must mean I'm brain damaged. I said, well, you were, not anymore. Because there's a healing process that occurs as we get older. So typically, as the brain grows, new pathways are formed, and we start to equalize. But because the female hasn't had any damage, she thinks globally faster than the man does, more easily. And part of that is that intuitive ability that females have. And a lot of researchers think that that's probably because of that difference. It could be other reasons as well. Some men have that intuitive ability also, so that perhaps that might be saying that their brain might not have been as damaged or something. But when that difference occurs, then our moods are going to be a little different. How we perceive things are going to be a little different, and so on. So men with depression are more likely to be very tired, irritable. You know, we don't like that, and sometimes angry, and we don't like that either. So when you tend to see that in someone you love where that's not normal, then okay, kind of pay attention. Maybe there's a little depression going on there. And for us men, we identify with our jobs, our careers, those things that give us value as men. And if things aren't going so well at work, a man's not necessarily going to talk about it. And so he gets depressed over time because he's turning that stuff inward, and that anger or frustrations that get turned inward because they have nowhere to send it, they have nowhere to dump it. It gets turned inward, and it starts to turn into something else, and that's many times moodiness and depression may occur. Temperaments play into this also for men and women, and we'll be talking about temperaments in another video. But when that occurs for men, then there's that added, when we get angry, we say things, grouchy and all that. Old age gives me a little grouchiness, and I use that as my excuse when I get grouchy. Men may also, in those times of depression, lose interest in their work, something that they've been dedicated to, something that gave them an identity, a sense of value. Suddenly, it's not there now. Whether there's problems at work or whether it's the depression, they start to behave recklessly, making poor choices, poor decisions, and they will tend to misuse things like alcohol, for example. Most alcoholics, especially chronic alcoholics, they're self-medicating. There's another issue going on. Most men who turn to those things, turn to it to self-medicate, and they don't go to see the doctor, they don't talk about it, so they're not recognizing it as depression or perhaps anxiety or something else. And instead of getting the legal medication that's going to help them, they drink, or they drug, or they do other things that aren't so good. So depression for men can be one way or another, but generally you see that irritability there quite frequently. And when you see it, be patient. Don't react to it. If it seems to be persistent and out of the ordinary for your husband or your son or your friend, give them a chance to talk about it. Why are you feeling that way, or why are you saying those things? Are you upset? Do you want to talk about it? And help draw it out as far as what's going on, to help find out what's going on. Now, for us older guys, us senior citizens, the older adults with depression, there's those less obvious symptoms. They may be less likely to admit feelings of sadness or grief. For men in particular, it's the regrets of perhaps not having the career that they wanted to have, or the job that they wanted to do. Perhaps poor choices in their past, making choices of one thing or another that they deeply regret. And so they start to feel that, and they fight it because they're men, so they fight it. And in fighting it, they do things, they work more, or they become more active with other things to forestall the depression, replace it with some stimulation. They're also more likely to have medical conditions, heart disease, oftentimes will contribute to depression. Some medical illness will contribute to depression. So for men, they're hiding it still in their senior years. For women, there's going to be, I'm going to talk about it, I don't feel right, I'm going to get help, I'll take the medicine, or I'll join the dance class, or I'll participate more. But for women, they also try to forestall the depression through stimulation. And that stimulation can come about through activity, through drinking. So oftentimes I'll see the older women had been turning to the wine, drinking too much, and so on. But they're more relationship oriented, so they come together more in the older ages. And in coming together more with other females, they begin to adapt when they see the healthy ones, when they're going to lunch with 2 or 3 other females, and those females don't have depression, then the one who does starts to watch and pay attention and adapt, and they start feeling better. They're getting that stimulation. Sometimes it's, I need a change because the change in the past has helped me to feel better. Unfortunately, that was stimulating, but unfortunately, 2 or 3 months go by and the depression comes back, and then they need another change. And so you get some that just keep making changes, thinking that's what's going to help. That's just a temporary help. Younger children, gosh, how helpless we feel as parents when our kids are not feeling well. And then we put the blame on ourselves. What did we do wrong? Younger children with depression generally are going to pretend to be sick. Now, maybe not purposely pretend, but in their little minds, that's what they associate it with, and so they identify, well, I have a stomach ache, or I have a headache, or I just don't feel good. They don't want to go to school. They don't want to be around others. They cling to the parent, and they might have certain doom and gloom worries, like the parent may die, or the parent may get sick, or they may be abandoned. When they start talking about those kinds of things, pay attention, because they're saying something. It's not the words they're using, it's what's in between those sentences. It's what's behind those words that you look for to see what's really going on there. Older children and teens with depression may get into more trouble at school. So they tend to not feel well. They get a little agitated. They're confused by not feeling well, and they get grouchy, and before you know it, they're talking back to the teacher. They're not following instructions. They're having trouble concentrating. They're sulking, so that irritability causes difficulties with friends and with authorities in the school. And when you start to see that, okay, something's going on. Don't just take it for what's happening. Look deeper into it. Teens with depression may also have symptoms from other disorders like anxiety. Anxiety and depression often go hand in hand. And when you see a teenager that has a lot of worry, or there's that discomfort, restlessness that often seen with anxiety, talk about it with them. Eating disorders. That's frustrating, eating disorders, because it doesn't have to be that way. And very often, eating disorders are learned. Generally, it's a parent that, it could be a dad or a mom. Perhaps they have an eating disorder, or perhaps they may have a little OCD, obsessive compulsive disorder, about food or about the way the children eat, or perhaps they may feel like I'm not a good mom because they didn't finish their plate, and so I have to make them finish their plate, or they're not eating like I think they should, so there must be something wrong with them, and then they over-focus on the eating. If that occurs, then a youth can develop that over-focusing about eating. And so they stop eating, or they eat too much, or they binge, and then of course the purging can occur as well. Also with depression, there's substance abuse. And as I mentioned earlier, men tend to self-medicate using substances, or alcohol in particular. What do boys do? Well, boys are going to self-medicate, especially if they don't feel like they can talk about what they're feeling with the parents. Then they're going to look for something to make them feel better. They're going to escape to the substance. Or they might escape to sports. Often I see young people that turn to that stimulating sport because they're good at hitting the baseball, or good at playing football, or good at playing basketball. But the depression is still there. It hides it. As long as they're playing, they're stimulated. But when they stop, here comes the sadness, the blues, the worthlessness, the helplessness. I got to go play. And that's all they do. That's all they think about. So what happens when they become adults? It tends to be a habit that turns into a compulsion, that then, if it can, turn into an addiction. So they become maybe a pro football player, pro basketball player, but the depression's still there. It never was treated. They self-medicated using the sport, or they self-medicated using work, or they self-medicated doing something else. It's an escape. And because it's an escape, they're not dealing with the problem. It just keeps coming back, and it keeps hounding them. Well, what do you do when your kids get depressed? There's a few quick tips, because we're all concerned about our children all the time. Quick tips for talking to your depressed child or teen. Many tips out there, many good things. Just a few here to mention. The most important thing is love. Now, some adults have trouble with love. They have trouble with that bonding. Doesn't mean if you have trouble with it, you can't help your child, or you can't demonstrate to your child you care. Talk to them. Be emotionally supportive with them in some way. Just being a good listener, even if you can't attach emotionally, just being a good listener conveys to them you care. Be understanding. What is that? Well, if they say, I have a headache, you don't say, oh, no, you don't. If they say, I don't want to go to school, I don't feel good, oh, you have to go to school, forget about it. You'll feel better when you get there. No, you don't. Understanding is, wow, you must feel pretty bad. Do you feel like telling me what's going through your mind about it? Do you want to talk about why you don't want to go to school? Is it a headache? Where do you think the headache is coming from? Have you had this headache before? When does it usually happen? Bring it out. Talk to them about it. Show them your understanding. You care. It's being empathy. It's empathetic. They'll talk, and a lot of times they'll come up with their answers when they're talking, and they'll realize, oh, I can go to school. Of course, there's that moment where you have to go to school. But wait for the very end before you get to that moment of drawing the line. Patience. We all have trouble with patience, especially when we're stressed with whatever's going on in our lives. And if you have more than one child, Linda and I, we had 2 boys, and we thought that was stressful. My son, one of my sons has 4 children, and that's stressful. Patience is very important. You have to work at it, and when you work at it, you get a little better at it. So work on patience if you're having trouble with it. A lot of times we turn to God for that help in teaching us some patience, but you may have other methods that'll help you. Encouragement. You can do it. I know you could do it. You did well the other day in doing that. I'm sure you're going to do well again. You've got that capability of doing well. You're really good at it. Those little words of encouragement, that kind of goes right in there for someone, for a child, a youth who's kind of sad and gloomy, and they're thinking of themselves very poorly because they're comparing themselves to other kids or comparing themselves to you. And because they're small, because they don't have that power, because they don't have a full brain yet, they don't feel as smart or as strong or as powerful, so they feel valueless, and that moodiness can come in there, the depression can come in there. So encourage, talk to your child, but don't bring up depression. A little bit, but if you keep talking about depression or anxiety or worries, what are they going to do? They're going to do it more. They'll go, I'm going to, so they think more depressed thoughts, more negative thinking. If you're bringing up those negative thoughts, they're going to think those negative thoughts more. So you want to kind of do the opposite. Bring up the encouraging words, the hopeful words. Leave the word depression out of it as best you can. You can talk about the descriptive words of sadness. Are you feeling sad, blue? Why? Did something happen today at school that started this sadness that you're talking about? And help them identify the origin of it. For most kids, there's usually one little thing that happened, and especially if they're more loners than extroverts, then they'll tend to get moody faster. When you can identify it, it helps them to feel better. It's like being sick and you don't know why you're sick, and you go to the doctor and the doctor doesn't know why either, and he gives you pills and this and that, and then after a month or so, finally the blood test comes back and says, oh, you have a virus. Here's a pill for it. Oh, okay, I have a virus. That's what it is. That's why I'm feeling so bad. You feel good that you've just been identified as being sick with something. Relief. Kids are no different. They're even more so relieved. So if you help them to find a source, and then give them those words of encouragement. So never ignore what your children are saying to you. It may be silly, it may be off the wall, but everything has something behind it. It's like a dream. Every dream has meaning. Everything in a dream, a wall, a table, clothing, a computer, everything in a dream has a meaning. What is the meaning of the flowers? What is the meaning of the blue wall? What is the meaning of this or that? As you dig to discover those meanings, suddenly a picture is formed of what that dream is all about. And oftentimes it gives you answers that perhaps you hadn't thought about. No different with kids when they're communicating what's behind this word, what's behind that word. Remind the child that there's help. They cut themselves, oh, we can fix that. They get a bruise, oh, we can do that. It helped me when I rubbed the bruise gently and got the blood going, and it felt much better. When they hear that, they feel better because there's some hope there that it's not going to hurt all the time. Most importantly for teenagers, if they talk about morbid things, suicide, death, maiming, things that are kind of associated with death, pay attention. Don't disregard it. Don't say, oh, stop thinking that. Where's that coming from? Help them to find out where it's coming from. They really want to tell you, but they're afraid of looking stupid. They're afraid you're going to criticize them. They're afraid you're going to talk them out of it. Well, you want to talk them out of it, but listen first. Help them to talk about it. As they talk about it, they start to feel better because you're hearing them and they realize they're not alone. Suicide among teenagers very often is just that I'm all alone. No one will understand. No one cares. There's no way out of this. And they turn to those kinds of things. That's so unnecessary. I feel so bad when I hear about a teenager doing something like that, and I realize all they needed was someone to talk to them about it. All they needed was some help. All they needed was to know they had access to a source that understood what they were thinking, feeling, or experiencing. Pay attention to that. And many times teenagers go through that little phase where it doesn't mean they're going to commit suicide, but still, let's pay attention, don't ignore it. And certainly if something happens, what do? You blame yourself, and you lose the most valuable thing in your life. Well, what do we do now? All that we've talked about here are the types of depression, how it affects different people. We've talked previously about treatment for it, and yet sometimes that's not even enough. Many times, for most people, depression is an attitude. It can even be an addiction. If I don't feel good, if I feel bad, I'm thinking bad. If I'm thinking bad, my soul, my mind, is transmitting to my body the feel-bad chemicals, the feel-bad communication, and the body's going to get sick. Some people have a more direct connection with that, so they might call that psychosomatic issues where if they think it, they feel it. There may not be a medical problem causing it, but their thinking is causing a medical problem. Attitude. What's my attitude? Is it good? Is it bad? Have I been thinking negatively? Certainly if you're depressed, you've been thinking negatively. So how do I improve my attitude? How do I improve my thoughts? I have to think on those things that are good. Philippians 4, chapter 4, talks about those things that we should be thinking about. Think on those things that are good. Listen to what God's saying. Renew your mind unto godliness, and so on. So in Christian counseling, faith-based counseling, we look for that spiritual help as well. There's the soul, your mind, there's the body, but there's also the spirit. We treat all three. In Matthew 11:28-30, in the Message Bible, it tells us, are you tired, worn out, burned out on religion? Come to me. That's Jesus speaking. Come to me, he said. Get away with me, and you'll recover your life. I'll show you how to take a real rest. Walk with me and work with me. Watch how I do it. Learn the unforced rhythms of grace. I won't lay anything heavy or ill-fitting on you. Keep company with me, and you'll learn to live freely and lightly. What's he saying there? He's saying, you want to feel better? You want to lift the burden? You want to feel brighter? Or you want to be less anxious? Sure, there might be medical reasons for whatever problem you might have, but if you only address it medically and you're not addressing the soul, the spirit, then it's likely to come back, either the same thing or something else. So addressing the spirit, soul, and body, you're addressing all the parts of you, and Jesus is talking about that. Think like he thinks. Follow his model. Start reading the Bible, not just listening to what people say about it. If you're in another faith, start reading your faith. Look at the good stuff. Don't look at the bad stuff. We have proof in the Bible that God is real. We have all these promises that have all come true up to our day and time. No other religion can make that claim. So we're more confident, I would say, in our faith. And so we focus more on the teachings of Jesus in the New Testament, and we use that model to follow. Okay, I hope that was helpful for you. God bless.